Good morning to all. In this presentation, we will see about experimental epidemiology. The experimental or interventional studies are carried out under the direct control of the investigator. So, investigator has the control over the interventions which are conducted in the study. The study involves any action or intervention which is done in the experimental group or manipulation of certain factors. Example, we will be deliberately applying some preventive agent or withdrawing some causative factor or the suspected cause in the experimental group, and we will have a control group where we will not do any changes, but in the experimental group we will be either deliberately applying or withdrawing some factor, and we will be comparing and seeing what is the effect which is caused. And the aim of experimental epidemiology is it provides the scientific proof for any etiological factor which will permit us to do modification or control of the disease, and it also provides the methods of measuring the effectiveness and efficacy of health services either to prevent or to control and to treat a disease, and also to improve health of the community. So these are all the main aim of experimental epidemiology. So it is the main type of epidemiology which gives us a scientific proof for etiological factor. Experiments are done mainly in two methods. One is animal experiments and other is human experiments. And animal experiments are done because we can reproduce the human diseases in animals to confirm the etiological hypothesis, and also to test the efficacy of various therapeutic or preventive measures such as vaccines or drugs, and also to find out the natural history of disease pattern. And the animal experiments are done carefully in breeded animals in the controlled environment, and the advantages of animal studies are since animals are bred in laboratories and it is manipulated according to the wishes of the experimenter, and the animals can be rapidly multiplied and enable the experimenter to carry out the experiments which are not possible in humans. But the limitations of animal studies are all the human diseases cannot be directly replicated or reproduced in similar way in the animals, as well as the results of animal studies alone cannot be extrapolated to human beings. And human studies or studies done on humans were much needed to investigate about the disease etiology, and we can also to evaluate the preventive and therapeutic measures. And human studies should be designed in such a way that it should be logistically possible and ethical implications are looked through. And the few examples of human studies are conducted by James Lind in 1747, where the sailors were provided with orange and lemon in their diet to prevent scurvy, and the Edward Jenner's cowpox vaccine has been developed as a vaccine against smallpox. This is one of the examples of typical human studies. And experimental studies are basically of two types. One is randomized control trial and other is non-randomized control trial. In randomized control trial involves a process of random allocation of individuals in experimental as well as in control groups, whereas in non-randomized control trial the strict randomization protocol is not followed, and the steps involved in randomized control trials are, first is we should draw up a protocol, and then we have to write about the selection of reference and experimental population, the randomization, how we are going to do the random allocation, manipulation or intervention, what manipulation or what is the intervention we are going to do in our study, we should explain in that, and the follow-up protocols and the final outcome will be assessed. So these are all the basic steps in randomized control trial. And the design includes, so first we will be select a suitable population, either the target population, and then from that reference population we will select a suitable samples for our study, and after selecting the samples we should take informed consent from the individuals who are participating in the study, and those who are not willing to participate we will exclude, and based on the exclusion criteria we will be fixing up, and those who are not comes under it we will exclude the individuals. Then randomization will be done to allocate the interventional or the experimental group and to the control group, and both the groups we will do follow-ups. In the interventional group we will do intervention, whereas in control group we will not do, but we will do the follow-ups, and then we will assess the final outcome of the study. So the first step is drawing up a protocol. So it should be always, randomized control trial should start up with a strict protocol, and it should be followed throughout the study period, and the protocol will specify what is the aim and objective of the study, and how we are going to select the study and the control groups, and how we are going to allocation of study and control groups. The sample size should be estimated, and what is the treatment we are going to apply, or what is the intervention or manipulation we are going to do, we will tell and write up in the protocol. What is the standard working procedure we are going to follow in the study, and at what stages or when and all we are going to evaluate or follow up, when we are going to do, and then the final outcome of the study, how we are going to assess it. So we will include all these headings while drawing up the protocol. And while selecting the reference or experimental population, the reference or target population can be as wide as the whole mankind, or it can be limited to a certain geographical area, or limited to persons with specific age, gender and occupational groups. And we can also select the reference or target population from school children or the whole society, that is the general public, we can select it. And the experimental or the study population will be part from the reference or target population, and they should be chosen randomly from the reference population, because they should depict the same characteristics of the reference population, so that bias will not happen. And the criteria for selection is they should give an informed consent, and they should be eligible or qualified for the trial, and they should be of representative population from the target population whom they belong. And third step is the randomization, and it is called as the heart of the randomized control trial, and it is a statistical procedure by which we are going to allot the sample population into the study and the control groups. So randomization is why it is done is to eliminate the bias and to allow the comparability between the control and the experimental group. The fourth step is manipulation. What is manipulation is, having formed the study and control groups, the next is to manipulate or intervene. That is either to withdraw or redirection of the suspected causal factor, or we can give some drugs or vaccines as laid in the protocol. And then we have to do a follow-up, and this implies examination of the experimental as well as the control group in a defined interval of time. So what time period we fix? Suppose if we have fixed for 3 months interval, 3 months trial. So with yearly checkups, then yearly follow-ups, then we will do an yearly follow-up as we have described in the protocol. Thus follow-up may be short or it may require years or decades depending upon the study which has been taken. And the assessment, the final assessment, it can be of give a positive result or negative results. That is, positive results is the benefits which they are getting from the experimental measures, and it might reduce the severity as well as the incidence of the disease, and the cost of the services also will be less when compared to the control groups. Sometimes it can also produce negative results, that is, the severity and the frequency of side effects and complication can be there, and sometimes it can lead to death. So these are all the assessments what we will do. So to prevent the bias, the step which is taken in randomized control trial is called blinding, and it can be done in 3 methods. One is single blind, double blind and triple blind. So single blind is the trial is planned in such a way that the participant doesn't aware in which group he belongs to, whether in the study group or in the control group. And double blinding is, it is planned in such a way that the participant as well as the researcher will not be knowing the person in which group he belongs. And triple blind is one step further, where the participant, the investigator as well as the analyzer who was analyzing the data also will be blinded, or he or they also will not know which group each person belongs. So examples for the study designs in randomized control trial is, the most commonly followed is concurrent parallel design and crossover design. In concurrent parallel design, once the random allocation is done, that we are separating the intervention group and the control group. Throughout the end of the study, whoever is in the control group will be in the control group, and whoever is in the intervention group, he or she will be in the intervention group, and we will do up the follow-ups, and finally we will evaluate and see what is the effect which has been caused. So they will remain in the same group throughout the study till the evaluation part. So that is concurrent parallel design. What is crossover design is, we are randomly allocating into intervention and control groups. Then we will do the intervention in the intervention group, and we will keep the control group as separate, and we will evaluate for certain period of time, and then we will give one time period to remove all the effects which has caused by the manipulation or the intervention which has been given, and then we will cross over the groups. The control group will become now the intervention group, and the intervention group will become the control group, and then we will check the efficiency or efficacy of the treatment which is provided. So this is called crossover design. So this is the two basic designs which is followed in randomized control trial. In concurrent parallel design, where patients will be exposed to certain treatment and the control group will be unexposed, an observation or follow-up will be done, and we will compare the outcome in both the groups. So this is concurrent parallel design. Whereas in crossover type of study design, the patient will be exposed to specific treatment in the intervention group, and in the control group they will not be exposed to specific treatment, and then we will observe for a period of time. Then we will give a time period to for the crossover to happen, because this effect will be nullified at this time period, and then again the intervention group will become the placebo group and the placebo group will become the intervention group. Then we will finally evaluate and compare the outcomes. This crossover type of study design, and the design which is followed in dentistry is one more design called split mouth technique. That is, in the same patient, one side of the arch will be considered as experimental group and the other side of the arch will be in the control group. So one in the experimental and other in the control group, because they will be providing the same environment in the person's oral cavity. So the effect will be only mainly based on the treatment which is given on the one side, and the non-treatment which is done on the other side will give the effects. The types of randomized control trials are clinical trials, preventive trials, risk factor trials, cessation experiments, trial for etiological agents, and we can evaluate the health services also in randomized control trial. So in clinical trials, what we will evaluate is the therapeutic agent or the drug efficacy of the drug what we are introducing into the market. Example is, suppose evaluation of beta blockers in preventing the mortality in a acute phase of myocardial infarction. So this is one of the example for clinical trials. And preventive trials is mainly done for the vaccination trials or preventive methods which are formulated to check their prevention efficacy. We will be doing it. Risk factor trials are done to investigate the usual sequence in the development of disease for those individuals who have the risk factors for the development of the disease. Suppose we can, how much elevated in the persons who are having the risk factor of smoking, cholesterol or hypertension, and how much they are prone for the development of coronary heart disease. If we are evaluating, then that becomes the risk factor trial. Sometimes it can be a single risk factor or a multiple risk factor also can be checked. In cessation experiments, we will try to remove the habit or inculcate some new habit in their day-to-day activity, so that what is the considerable causality which is reduced due to the inculcation or the removal of certain habit, we can experiment in this type of cessation trials. Example, the hypothesis causes greatly strengthened. Example is cigarette smoking and lung cancer relationship we have already know, and the cessation of the habit does how much reduction it shows in the development of lung cancer once the cessation the habit has happened. So trial for etiological agents, this one we will do mainly because to confirm the etiological hypothesis. If we consider some factor as an etiological agent for certain disease, if you remove that agent or if you inculcate it, what is happening? An evaluation of health services is how much improvement it is causing in the individuals after the application of certain programs or health services which are provided. We can evaluate in this type of research. For example, the hospital care for tuberculosis costs so much as compared to the domiciliary treatment or the DOTS therapy, where direct observation is done in the tuberculosis patient, and which reduces the cost of the treatment also, and the effectiveness also has been increased when compared to the hospital team. So this is the evaluation of health services These are all, we have seen the various randomized control trials. Now we will go on and see about non-randomized control trials. Although the experimental method is the most preferred, sometimes due to the ethical aspect or the administrative and the reasons to resort to randomized control trials in human beings, we will be conducting the non-randomized control trial, because we all know that smoking cancers lung cancer. We cannot induce the habit of smoking and check for the risk which has developed due to the risk which develops due to the smoking habit. So in that types of studies, we can choose a non-randomized control trial, and sometimes preventive measures can be applied only to groups or on a common wide basis, and it cannot be applied on a randomized basis. So for that studies and all, we will be taking the non-randomized control trial. And also, suppose if the natural history of disease is long or the duration of causation is long, then we cannot do a randomized control trial and follow up for decades. So in those type of diseases, we can go for the non-randomized trials. In non-randomized trials, the types are uncontrolled trials and natural experiments. What is uncontrolled trial is, initially uncontrolled trials may be useful in evaluating some specific therapy to have any value in the particular disease or to determine the appropriate dosage, as well as to investigate about the adverse reactions. The uncontrolled trials are done. And in natural experiments, where the control group we cannot have, but we should have a comparison group to prove the efficacy, means then we can, at that circumstances, we can choose the natural control group. For example, the smokers, if we want to check the effectiveness of or the impact of smoking, we can choose, naturally itself they are divided into smoking group and non-smokers group, so we can compare with those two groups. And the third type of non-randomized control trial is before and after comparison studies. There are community trials which follows into two groups. One is before and after comparison with control, as well as before and after comparison without controls. Without control and with controls. So example for before and after comparison without controls are, if the study is comparing the incidence of disease before and after introduction of some preventive measures, we can do comparison studies without controls in this type of researches, and in other words, the experiment serves as its own control. So example for without control is prevention of scurvy among the sailors by James Lin, where the sailors have been given provided with lemon and oranges, so they can compare before giving oranges and lemon, and they themselves are the experimental group after providing them with lemon and oranges. So this is one of the example of with and without comparison, before and after without comparison studies. And study conducted by John Snow to prove that contaminated water is the cause for the cholera. Before and after comparison, this is one of the example of before and after comparison, because before they were using the water from the contaminated hand pump, they serve as the experimental group, and after eliminating the usage of the contaminated water, what is the changes which has happened. So they themselves are the experimental and the control groups. So we can do this before and after comparison when the following things are needed, that is data regarding the incidence of the disease before the application of the agent or the removal of the causative factor, and the diagnostic criteria for the disease should remain the same, and the adoption of preventive measures should be applied in the particular area. And examples for before and after comparison with control group is, in whichever treatments we cannot have control group, we can select the naturally occurring control groups for this. Example, in the absence of control group, comparison with other observation before and after the use of new treatment or procedure may be misleading, because without having the controls, sometimes the results can mislead. So we can have a control group, but the control group can be selected from the natural control groups. The advantages of experimental study are, the researcher is having the entire control for the investigation what he is doing, and the results are ensured, or it acts as the scientific proof for the hypothesis, and it is well reliable and well respected research design, and what are all the factors which are involved also is identified by this type of research. And the disadvantages are, sometimes when there is multiple causation for the disease, sometimes it might be create complexity in telling the natural history of the disease. Ethical issues is one of the important concerns in experimental design. If blinding has not been done, researcher bias or subjectivity can happen, and also Hawthorne effect can be seen in the experimental studies. What is Hawthorne effect is, if persons know that they are under some study groups, then they will try to improvise in their habit or in the attitude, since they have been watched by some observer, so they will be overcautious, and this can produce a Hawthorne effect. So coming to the conclusion, in the last few years the method of epidemiology has refined, and tremendous attention has been given to update the knowledge on the disease burden in the population, which is mainly helpful for or essential for the health authorities, and this provides the health authorities to seek or to use the limited resources with the most possible effect, and they can introduce or they can develop policies to prevent, for the preventive care and the promotion of positive health among the community, and thus epidemiology seems to the main area or the field of interest for identification and control of disease. Thank you. And these are my references, and thanks to the SWAYAM courses which are conducted. Thank you.